now. So before we start, I have a couple of announcements, and the presentation will be available to download both in English and Spanish as a PDF after the session. En español, esta presentación estará disponible para descargar tanto en inglés como en español en forma de PDF para todos. So if you have any questions through the presentation, please submit any questions via the chat box as they come to mind, and I'll try to respond at the end of the presentation. So let's get this underway, and thank you for attending. So the objectives of this morning will be as follows. We're going to have talk a little bit about a history of surgery, very briefly. We're going to talk about some of the key components that make research really work. And we're going to talk a little bit about variables, and in particular as it pertains to surgery. And we're going to talk about the problems related to unalleviated pain. So very brief history. The earliest manuscripts related to animal testing date back to 4000. Aristotle was one of the first to conduct live animal experimentation. But I want you to pay attention to this individual by the name Edmund O'Meara, who said that the miserable torture of vivisection places the body in an unnatural state. So O'Meara sustained that an animal's physiology may be affected by pain through vivisection, resulting in unreliable data. It is interesting that this man said this back in 1655, and today this is proven more true than ever. So I know that the word vivisection can be offensive to some, but let's try to define it a little bit. According to Merriam-Webster, vivisection is the cutting of or operation of on a living animal, usually for physiological or pathological investigation. I know it's an offensive term, but broadly said, it's really it's related to animal experimentation, especially if it is considered to cause some distress to the subject. So keep that in mind, and we're going to be talking about stress, distress, and pain throughout this presentation. I'd like to preempt this by saying I'm not going to go into any particular techniques. I know there's going to be some presentations, maybe we'll provide some of that information, but this presentation is more philosophical, and I hope that it will stimulate your minds and your thoughts. Okay, so let's talk about the IACUC. IACUC, for those of you who work in institutions where don't know what the IACUC means, is also the Oversight Committee. The IO represents the institutional official, according to many institutions in the United States, but it represents those individuals who really hold the purse strings and that can finance the institution, have been given charge or responsibility for the institutional animal care and use program. So these are the administrators. Then the AD is the attending veterinarian. So IACUC is the Oversight Committee. So the combination of these three bodies is it's so important, because these are the individuals that will filter down, that will put together all these standards, guidelines, and regulations, and for good animal care and use. So these are the individuals that really form the bridge for a good animal care and use program. So let's talk first about the Oversight Committee. What is a toothless? What is a weak IACUC Oversight Committee? Well, it is defined as an oversight committee that is at the mercy of the investigators, with little backing from the institutional official or your administrators, and with an attending veterinarian that has very little influence. In other words, a weak veterinarian. So it is a committee that is reduced to a feeble working group. In reality, it is a committee with little or no influence on investigators. It is a committee that is really at the mercy of the investigators. The investigators, principal investigators, control the program. I have been, I think many of us have been in programs where the investigators are in control, and when that happens, these are the ones where you can speak to them all you want to, will go one ear, then the other. But these are programs that are in trouble, where science will not occur like it should. Let's also keep in mind, not only is a weak oversight committee, a weak veterinarian, weak IO a problem, but the overbearing oversight committee also can have similar effects, because the overbearing committee is so concerned about nothing but regulation that it will have a similar effect that the weak committee has. It will inhibit science progress, and science will not be correct, will not be the right science in a program where the oversight committee is an overbearing one. So what is the answer? The answer is really is a balance between really being a tough oversight committee and really being one that really works with investigators. Luckily, at my institution, we have a great oversight committee where the balance, I believe, is really there. Where is the balance for each institution? I don't know. But I think at my institution, we have reached sort of a balance where science is progressing at a fast pace, yet investigators are not independent from the regulations and from everything else. So let's talk about medical research. What is research, really? Biomedical research, if you're an investigator, what your concern is about elimination of variables. Really, we need to get rid of variables, because by doing that, you as an investigator can focus on the study objective. That study objective can be either a behavior, a treatment molecule, lesion, it could be a drug, it could be a particular surgical procedure of some type. So when one can focus on the study objective and not the variables, then the data can be valid and it can be reproducible by eliminating the variables. And then that results in trusted publication, which is really the goal. So this is way too common. The investigator is looking at his objective, what he's looking for, that treatment, that drug, that compound, that lesion, that behavior. But so many variables can come into the data to produce such mixed data that at the end of the day, when that data is extracted, really the investigator doesn't know whether the results and the data is as a result of really the objective that he or she was looking for, or from the variables, or a combination of both. So the ideal scenario is really to eliminate all variables, so one can focus on the objective. Is this realistic? Probably not. But more realistic is that if we can minimize these variables by manipulating the environment, the diets, but really working with the animals, working with the veterinarians, with the IACUC, with the Oversight Committee, by having the right scenarios, environment, and practices, then the objective can be obtained with minimal variables. So that's why when the results are published, well, the investigator will say, we have 95% confidence. Well, it is when these variables are minimized that 95% confidence plays a role. But what is unacceptable is that mixed data where there are all kinds of variables, because that is a result of poor controlled science. That is a result of oversight committee that is, or an investigator, or the veterinarian that is weak. It is a result of investigators that are on their own, and there is just not that unity and that working together between the investigators and the institution. And particular the Oversight Committee and the veterinarian. So at the end of the day, as an investigator, you want trusted data, data that is reproducible. So let's talk about a few of the variables. Variables can be wide temperature fluctuations, come from temperature fluctuations. That's why in our facility we have a tight controls in temperatures and humidity, pain, stress, or surgical technique, little to no surgical training. Investigators that are doing these procedures with very poor training, and what they're doing, they are really causing a lot of tissue damage, and we'll go into that a little bit later. The use of poor sterile technique, inconsistent practices, pathogens in the environments, etc. So we're focusing on this presentation more on surgical trauma. So let's talk about surgery. Let's talk about trauma. So trauma will lead to elevations in catecholamines, cortisol, glucose, and some of the cytokines. And so trauma will impair GI motility and lower the ability of the animal to defend itself, really the immune system. And trauma will lead to increases in oxygen demand, pulmonary workload, and renal workload. So to the degree that trauma, and in particular surgery, occurs, it's to the degree that some of these parameters are affected. So therefore, the importance of minimizing trauma, so we can minimize these variables that we can see here. So let's see some of these variables. These surgery variables will lead to increased catecholamines, corticosteroids, growth hormones, We can go on and on and on. It will lead to decreased in hormonal levels, the homeothermic responses. Surgery will lead to fluctuations in certain hormones like insulin and glucagon. And so it is important that we understand that time is trauma. So the longer an animal is exposed, the longer during surgery, the greater the trauma. That's why the focus in good surgical training and practice. So what this graph, this image here tells you is that if the exposure time during surgery is increased from a half hour to 5 hours, the infection rate will go from 3.5% to about 16.5%. So the concept of time is trauma is key. That's why we need to go in and we need to get out. We don't just fiddle around on the importance of minimizing time. So for each minute, if you do the math, for each minute of exposure, we have an increase of an infection rate of 0.05%. Again, time is trauma. Because increased time will increase the degree fluid loss through the opening. It will lead to tissue drying, to hypothermia and cardiovascular depression. And to the greater degree that these things happen, the greater degree that the variables are being introduced into the research. Again, time is trauma. So let's talk about the implications of pain for a little bit. So pain. Pain is a form of stress, and stress and pain lead to variables. So let's define stress. So physiological stress upsets the body's homeostasis. The body responds by stimulating, look at this, through stress, through pain, the body responds to stimulating the nervous, endocrine, and immune systems, leading to short and long-term physical effects on the body. So how many studies are dependent on the nervous system, the endocrine system, the immune system? So when the greater the degree of stress, the more the effect that we're going to have on these systems. So, for the sake of definition, what is homeostasis? Homeostasis is a property of a system in which variables are regulated so that internal conditions remain stable and relatively constant. So the goal here is to work in animals with the minimization of variables. And the ideal animal is one that is in a good state of homeostasis, where variables are minimized and the animal is actually a stable animal. So, again, pain is a variable. And, you know, I'm the attending veterinarian at my institution. I review all protocols before they go to the Oversight committee. And frequently do I see, and I'm sure that a lot of you have seen the protocols where the investigators will say, although this is a painful procedure, I am unable to use analgesics, and they give you this scientific excuse, and they give you a huge list of why they can't give analgesics. And they might even cite from the literature, and they will give you great citations from the literature, where they might even tell you that non-steroidal anti-inflammatory drugs will interfere with this pathway and that pathway and this molecule and the other molecule, as well as opioids. Now, I'm going to ask you, and I think it's time that we challenge our investigators, which is worse, the effect the analgesics may have on data, or the effect that pain may have on data. So let's examine this, because I want you to go back to your investigators and really challenge this whole issue of the scientific excuse for not using pain control. So what are the consequences of pain? Well, pain will activate the sympathetic nervous system, will have an effect on cardiac output, which is, so we all know, is essential for good living and homeostasis. Vascular resistance would affect really the heart in general, oxygen demand, and will release myocardial toxins and even spleen ischemia. I don't want to read all these. I just want you to know that these are here, and these are some of the arguments that I bring to my investigators when they say, can I use pain control? And it will affect the kidneys. It will affect through the adrenal glands by affecting the aldosterone, the sodium water retention, and glucocorticosteroids. Many of our studies are highly dependent on the immune system, and these glucocorticosteroids that are released, they have an effect on the immune system. And of course, it will, for cancer surgery programs, it has a higher rate of metastasis and leads to mutilation and anorexia of the animal. The animals will lose weight, and immediately post-op, animals enter into what's called catabolic state. In other words, the body's eating itself, and the goal is to really turn these animals around as soon as possible. Pain accelerates this state. And of course, that affects clotting, that affects the mental state activities, and also the secretion of endogenous opioids. And of course, it leads to hypoxemia and hypercapnia. So let's go back to O'Mara. I think O'Mara, back in 1655, had an incredible point. An animal's physiology may be affected by pain during vivisection, resulting in unreliable data. Folks, let me tell you what's interesting, at least to me, about this, is that look again at the date, 1655. What O'Mara said back in 65 that carried so much wisdom, he really basically had very little data to support his statement. But today, we have a lot of data to support his statement. So let's talk about minimizing surgical trauma, because obviously the goal is minimizing variables so we can focus on the objective. So surgery. Skills are practiced, developed, and refined. Maybe I should have said it should be learned first. Excuse me. But once they are refined, you practice, and you practice, and you practice, and you practice until you're sick. I have done thousands of surgical procedures in my lifetime, yet it's amazing, even the simplest things, such as suturing a body wall, I still learning the trick. I'm still learning it better. There's a little thing that I'm learning better and better and better. But don't you dare going into your surgery, into your protocol, without really having a good grasp of your surgical procedure and having practiced, developed, and refined, and then practiced and practiced and practiced. Let me tell you about the miracles of acclimation. Many of us have ordered animals from Charles River, from Heartland, from your provider in Europe, wherever you're at. But you think about this. Okay, so you place the order. The order goes to your vendor, and then the vendor goes into the animal room and picks a few mice, and these mice are placed in a dark box. Then all of a sudden, oh my, I'm the mouse. I'm thinking, what is this? This is different. But this is, I feel a little bit stressed. And then the cage, the box is closed. It's dark, and then the animals are taken into a hallway, and then you go in the hallway, and then people are saying, how's the weather today? How are you? And they hear these strange voices, and then they go out into the loading dock, the individual carrying the box, and then all of a sudden there's a new sounds, new voices. There's a smell of diesel. There's a smell of strange odors that have, if you're the mouse or you've never smelled before, if I'm the mouse, I've never, this is stressful. I hear the sound of the truck, the vibration of the truck. I'm placed into the truck. All of a sudden, the truck takes off. And next day, I arrive to a new place. New voices, new hallway, and new environment. And I'm placed into a new cage, which I've never seen. Maybe I was used to aspen chips. So my bed is now on corn cob. What is this? Life stinks if you are the mouse, at least for a few days. So if you start using that animal the day after that animal arrives, you're having a problem, because you have an animal whose homeostasis is way out of balance. So there's data, papers that have been published that gives you acclimation time for various species. At my institution, we don't allow investigators to touch our animals for at least 3 days after they arrive. So please consider acclimation. And there's strong emphasis in the new guide for the care and use of animals on the issue of acclimation. It could be a strong and powerful variable. So antibiotic use. You have all dealt with investigators that everything they do, let's give them an antibiotic. Okay? Is that a good practice? First of all, it should not be used as a substitute for proper asepsis. It is so common. I've seen it. I mean, I've been in business for many years now. I've seen it commonly. The investigator, of everything he does, he wants to use antibiotics. It's really an excuse to not follow a proper aseptic technique. It needs to be used judiciously, because there's an ethical issue here. If we allow our investigators, if we use antibiotics indiscriminately, we will be creating resistance strains. And that is an issue that is really falls on, it's an ethical issue that really we need to avoid. Consider antibiotic rotation to minimize the resistance strains. At a previous institution where I was at, we used to rotate cefazolin with enrofloxacin each quarter just to minimize the whole issue of resistance strains. It's generally not recommended and should be justified in the protocols because it should not be a substitute for proper aseptic technique. And in fact, I don't think, and I'll mention it in just a second, that it could really lead to variables. It's one more thing you're adding to your study. It is best when it's used preemptively. So if you know that you need to use antibiotics, it is justified. Well, it is best to have the highest possible tissue levels and have the antibiotic the highest tissue levels possible. And then if once the offense occurs, the contamination occurs, then you use antibiotics. It's best to use it preemptively. And once pre-op is usually all you need. Of course, there are exceptions to all these rules. And again, remember there could be a source of variables. So let's assess the need when antibiotics may be needed. One, do you have an immune deficient animal? That might be a reason to use antibiotics. If you're going to be entering hollow organs, let's say the genitourinary tract, the gastrointestinal tract, the thoracic cavity, in some cases you may need antibiotics and it can serve as justification. If you're going to have to do extensive tissue dissection and blood losses, you're predicting, or you know that at the end of the procedure you had a lot of tissue dissection, blood loss, maybe antibiotics may be needed because the greater the tissue dissection, the greater the trauma, and the greater the chances of infection. If there's, for example, an inadvertent contamination during surgery, well, definitely antibiotics may be needed post-op. And if you're using devices and biomaterials like catheters and things like that, well, your chances of infection because of the materials that you're using could increase 1,000-fold. So maybe pre-op antibiotics may be necessary, and in some cases, even post-op antibiotics. If the procedure is predicted to be a lengthy procedure, maybe you need to have some coverage with antibiotics, aged and ill animals, and don't forget the inexperienced surgeon. The inexperienced surgeon is going to cause more trauma. Although the surgeon that has had a history of infection, these individuals that may need some antibiotic, but as experience and technique, it gets more sophisticated and experience increases, the need for antibiotic definitely decreases. So let's talk about anesthetics and hypothermia. All anesthetics depress thermoregulation and decrease metabolic rate. Let me tell you, folks, fear hypothermia. Fear hypothermia. The effects that hypothermia has on the body system, it could be devastating to the animal and to your research and, of course, to your data. So keep in mind that rodents lose heat very rapidly compared to larger species because they have a high surface area per body ratio, weight ratio. The cycle starts right immediately upon induction of anesthesia. It can be exacerbated because of the dry gases that we use. We use gas anesthesia. We shave the animal. We have to shave the animal. We use some cold prep solutions and the betadines, the chlorhexidines, and all that. And many will administer parenteral fluids without warming them up. And I tell you, it may be the difference between life and death, reliable and unreliable data, and really success and failure overall. Really, again, fear hypothermia because it will prolong recovery of the animal. It will increase the potency of the gas anesthetics. It will lead to hyperventilation. It will affect platelet function and affect the heart. And it increases the viscosity of blood. It's just the best way I can illustrate this is with the picture that you have here in the slide. If you're pouring oil through a strainer, you know that, or let's say if you're pouring water through a strainer, you know the water is going to go right through it, no problem. But instead of water, you're pouring oil. Oil will sticky. It will go through, but it will go with difficulty, and it will stick to the metal, but it just doesn't go like water. So water, the illustration of water through a strainer is equivalent to the gas exchange that occurs at the alveoli on a normal thermic animal. But a hypothermic animal is the illustration of oil through a strainer. Is sticky. It's like the exchange doesn't occur like it should. Fear hypothermia because it increases the stress response to surgery. And of course, it leads to increased chances of infection. The wound healing is definitely affected and leads to central nervous system depression. And interferes with drug metabolism. There you go. So, prevention. How do we prevent it? Well, we should all be monitoring the temperature in our animals when they're undergoing surgery or an anesthetic episode. Don't forget about cutaneous warming. Be careful with heating lamps. They can be dangerous. You can kill an animal with the lamps if you don't have a thermometer next to it if you're monitoring that. But heating blankets work well. Make sure that you're not overheating your animals. And airway heating is not a bad thing to do. Why not submerge your hoses that go from your vaporizer to the mask and just immerse in warm water? Maybe you can heat up the fluids that way. Warm fluids, don't forget to warm them up. Don't give them cold fluids if they need fluids. And preheat your prep solutions. Why not put your betadine and your chlorhexidine in the microwave before you use it in the animals? And of course, none of us are going to be putting our animals on a cold stainless steel table. And don't forget the heat pad under the cage, under the induction and the recovery cage. Remember that hypothermia that starts right in the induction of the animal. So have a heating pad right under the induction chamber as well as the recovery cage. Another point is of great importance is the issue of non-pharmacological methods of pain control. Don't forget that it's not all about the drugs. It's not all about giving the mouse or the rat an analgesic. We forget about it. There are methods, and there's greater and greater emphasis in the biomedical research community about using non-pharmacological methods to control pain and stress, of course. So let's talk about a couple of those. Don't forget about the extra calories. So, as we discussed earlier, when an animal undergoes a surgical procedure, that animal enters a catabolic state, which needs to be reversed as soon as possible. Because an animal in a catabolic state is obviously an animal whose homeostasis is way out of balance. So why not do something to encourage those extra calories immediately post-op? So why not place food on the floor? There are many ways of doing this, but I'll give you a couple examples that have worked for us here at the institution, and also I'm the attending veterinarian of another institution, and I'll get into that in just a second. So the diet gels, one of the most recent studies that we've done is I had a study where we did bone transplants into the tibia. As you all know, bone surgery can be quite painful. Of course, we cover the animals very well with good analgesic protocols pre-op and even post-op, but we used gas anesthesia, isoflurane. These animals were immediately post-op after closure. We placed them in the recovery cage, of course, with a heating blanket underneath and all that. So we like to practice what we preach. So we had a diet gel, as you see here on the left side, this recovery diet gels. And I tell you, these things are so delicious, at least to the rat. The rat couldn't even get up. But these rats, and we saw it in time after time after time, that these rats, all they could do was lift their heads, and they were just, by lifting their heads, they were just lapping this dye gel. They just love it. So think about, here's a good example that could be useful. And the nice thing about the dye gels is that they're contained in their own containers, so there's no contamination of the feed. So the other one is bacon softies. I'm a strong believer of the bacon softies from BioServe, great company, BioServe. These bacon softies you see here on the right, we use it in this other company, local company that I'm the attending veterinarian. All they do in this company is cancer research. That's it. So when you are doing, when cancer research is done, what's going on? Well, these animals can succumb to the cancer, or they can succumb to the chemotherapy. So these animals can become cachectic, lose weight. They can become very malnourished very quickly. These animals can go off feed very quickly. And they look very, very skinny. And in fact, we have endpoints that we follow, but these animals we need to reach the endpoints, and the animals need to be euthanized. Well, when we started the practice, when these animals are starting to look cachectic before they reach the endpoints, we gave them bacon softies. It's amazing the turnaround of these animals. It's amazing how well they've done, because whereas they may not eat the regular diet, or maybe they're eating it and they're just not getting enough calories, but I think the aroma and the taste of bacon must be delicious for these animals. So they will go to, after the bacon softies, not only that, are they eating more, but they're eating something with higher calories. Social housing. The single housing post-op appears to be the norm in most protocols. However, a study by Van Loo, published by Van Loo et al., showed that rats that had spinal cord injury had a 20% less chance of survival when housed individually. And the mice that had telemetric implant surgery, when they were housed socially, they recovered a lot quicker. So I want to challenge this whole concept that if I put my mice together or my rats together, they're going to be picking each other's wound. I think we veterinarians at Oversight committees and IACUC, we have been too soft in this. I think because animals are social, mice and rats are social animals, are other species as well. I think we need to reconsider this whole issue about individual housing post-op. Enrichment, let's not forget enrichment. Because what enrichment is about creating an environment that is more like species specific. Let me just give you one scenario, one example. I used to be the attending veterinarian, the director in a previous institution. So I had an investigator that implanted a telemetry device in the abdominal aorta. And one day, and then he would measure blood pressure remotely with non-invasively after surgery. These were Zucker rats, they were obese, diabetic rats. So I noticed there was, I was new at this institution, there was no enrichment of any type. So I go to the investigator and I ask him, hey investigator, would you mind if we put some EnviroDry, what you see here, EnviroDry, what you see in the middle picture here. And so he said, sure, let's do that. So we we put EnviroDry. Months later, I run into the investigator because this was not at my headquarters, it was at another site in El Paso, Texas. And I run to the investigator again and tells him, Marcel, I have to tell you this. Ever since we started EnviroDry, the mean blood pressure has dropped 10 to 20 points. So of course we wrote a poster on this because we found this to be fascinating. So it tells you that animals really need, when you provide an environment that is species specific, the stress level goes down. What does stress do to blood pressure? Blood pressure goes up when the animals are stressed. You decrease the stress, and the animals you bring an animal closer to a homeostasis state. These red boxes you see on the right, we implemented a couple years ago, we implemented the red boxes on all breeding animals. So, of course, investigators object at first, but they all came on board. And a few months later, I get an email from an investigator that tells me, hey, Marcel, you will not believe it. Ever since we implemented the red boxes, remember the red boxes, mice and rats don't see through the red spectrum, and they think they're hiding from you, so they're not as stressed because they don't see the people in the room. And they tell me, this investigator tells me, Marcel, ever since we implemented the red boxes, my rats went from an average of 6 pups per litter to 12 pups per litter. I think this is significant. So don't forget the enrichment, which is a very important part of post-op recovery. So in conclusion, these are some of the take-home thoughts. A strong but reasonable oversight committee, or oversight overall, improves science. But again, I say strong and reasonable. Strong alone is not enough, but it has to be a strong but reasonable oversight committee. Don't forget about variables, because we need to minimize surgical and non-surgical variables for good outcomes. Don't forget about good pain control. Don't forget about the complete perioperative care. And with that, I mean the pharmacological, non-pharmacologicals, the fluids, the warming of the animals, the normothermia. And don't forget that good training leads to good surgical technique. And don't forget the calories. And as the enrichment, a good, strong enrichment program will yield better results. Thank you very much. And I will entertain any questions at this point. So here's a question. If we are considering an analysis performed three-fourths of the week after the surgical procedure, does the animal recover fully without major? Let's see, I don't see the rest of the question. Okay, I see it here. If we're considering an analysis performed three-fourths weeks of the weeks after the surgical procedure, does the animal recover fully without major intervention, antibiotics, thermic regulation, or implementing these tips only works for more acute settings? No, I think they work for just about anything. And you're going to have to tailor these to your particular program and work with the investigators. Yeah, these are tips for everyone, for everything. Do you think that to avoid rats to bite cage mate, do you think that to avoid rats to bite cage mate implants, habituating the rats to some kind of non-invasive implant in the cage will help? Of course it will. It will. I didn't talk about acclimation of the animals to really the cage and then anything that is in the cage. Great presentation. Well, thank you for saying that. I appreciate that. You listed the effects of pain on the data and the animal. What are the effects of analgesics on the data and the animals? Having both these lists will be helpful when explaining to scientists why the use of analgesics is more ideal than not for their studies. So I have a list of papers, and I'll be glad to provide it to by conference live, of several publications that will give you some understanding on the effects that analgesics can have on certain pathways. It is true, their analgesics and anesthetics can affect certain pathways in the body, but the whole issue needs to be weighed, the effects that the analgesics may have versus the pain may have on the body. So I will be glad to provide those, and I'll work with Dr. Stefan Baran and by Conference Live to provide that information. Hello, Marcel. I am Mariela from Chile. Hey, how are you, Mariela? Nice to have you. Is there investigation papers to show the investigators the effect of pain over their data? Thanks. Yeah, there is some, and I can work with Dr. Baran to provide some of that information. Uh, do you account for practice animals? Yes, it is. Uh, I'm not sure exactly what the question is, but it's important to have in your protocols add a few practice animals so you can develop technique. Remember, practice, practice, practice. In the case of implantation of devices that will remain indefinitely in the mice, for how long do you recommend to keep antibiotics after surgery? Well, at the previous institution where we used to put vascular access ports, we kept the animals on antibiotics pretty much throughout. And it's going to depend on the implant. Some implants may not need, particularly, those involve more stainless steel versus catheters, may not need as much antibiotics. It's going to depend on the implant. Thank you, Andrea, for the nice job comment. I appreciate that. Nice to have you. How we can use the red boxes like enrichment strategy and avoid behavioral differences with control subjects. Well, that's an issue you're going to have to deal or to work through with investigators. These red boxes work great. You may have to really make that decision at your oversight committee level or working with your IACUC. I cannot give you a specific answer for every protocol. Apologize. And okay, this question is in Spanish, but I'm going to translate it. Hi, Maria, how are you? Is it justifiable to use antibiotics when animals are going to be sacrificed about 3 days post-op? Well, it depends again. Maybe, maybe not, but you know that an infection can set out very, very quickly post-op, even within hours. So if there is a concern that infection can interfere with your research, you may consider antibiotics. Your slide said female mice recover more quickly after telemetric surgery. Is there anything to indicate males and or rats do the same? Well, there are not too many papers about the support of this statement, but I would only assume that that's the case. Would wet food on the cage floor help increase calories for pain management? Yes, it could, because when an animal is recovering post-op, the pain itself may preclude the animal from, at least immediately post-op, from just reaching after the feed hopper. So putting wet food on the bottom of the cage could be helpful. I'm more partial to some of these like recovery gels and the bacon softies, but yeah, you could use those. Do you think analgesia is possible in pregnant animals without affecting the pups? Oh yeah, definitely. There are many. You need to read the inserts and look at the literature. But yes, I think it could be used and it should be used. And I'm a real partial towards enrofloxacin personally. Thank you for your presentation. What else do you recommend to provide to mice and rats for extra calories if we can access the diet gels and the bacon? I have in the past very effectively provided what's called a peanut butter chow mix. What I do is that I mix half and half powdered chow, rodent chow, with half peanut butter, and I mix it a little bit with water to kind of make it a little bit more palatable, and I put it in a little container at the bottom of the cage. And I think I have reached the end of my time, 10 o'clock done. Can I continue or should I stop at this point? I will send Don a chat to see if I should stop. Until he tells me, okay, he told me I could continue for a few more minutes. For rats in a tail suspended study, I am using extra calories and enrichment, but not red boxes. What else could I provide to alleviate stress? You may provide what I advise you to do is because there are so many suggestions. Go to bio-serve.com. They have all kinds of enrichment devices that you can just choose from. And that will give you a more comprehensive answer that I will give you in just 5 seconds. Some institutes recommend analgesic treatments for 2 days post-op. Well, others do 3 days post-op. What do you recommend for your investigators, and have you noticed any difference between duration of treatment? We work very closely with the Veterinary Bioscience Institute, and who has also worked very closely with Paul Flecknell. Many of you know Paul Flecknell, great individual, great authority in the field. And together with him, we have developed some tables that will help decide on the type of analgesia for the particular technique and for the duration. We generally, for moderate to severe surgical procedures, we recommend at least 2 or more, like 3 days. So it really gonna depend. You're gonna have to make a clinical assessment, but we will be glad to provide a link to these tables. Okay. Thank you for the compliments. For researchers who are adamant that analgesics will alter their data, how hard to push them to use them? For example, at our institutions, several of the researchers declare opioids will greatly affect their studies investigating the effects of inflammation and the immune system. I had the exact same problem. So I push them, and they win many times. Remember, I don't know who what your role, Adam, is at your institution, but if you're the attending veterinarian, don't take this responsibility on your own. Include your IACUC, your oversight committee, in making a decision. At least you are presenting the data to the committee, and by vote of the majority, that decision is made. I do push them to a certain extent, but there's a point where I just can't go anymore. I need to let the IACUC, the oversight committee, make that decision. Good question. In terms of larger animals, we usually give IV dextrose, but it becomes difficult for mice and rodents. Any suggestions to maintain glucose calorie? We recommend for mice and rats before every anesthetic episode, because anesthesia will lead to hypotension, will lead to all the problems that we discussed earlier. We recommend that for mice in general, at least 0.5 to 1 ml of preoperative fluids should be given. If an animal is cachectic, or if an animal is in need of extra calories, 5% dextrose can be given, sub-Q IP. For rats, we recommend in general, depends on their size, to adult rats between 5 and 10 mLs pre-op, or even during surgery. It is Michaela, thank you for the note. It is always a pleasure to see and listening to you. Hope you can make it in May. Well, it happens to be that I'll be going there to Chile in May to work with you folks, and look forward to that too, Michaela. What do you think about fasting prior to surgery to rodents? I don't think it needs to be done because of their high metabolic rate. There are very few exceptions in which fasting rodents may be necessary. And the fact that they don't have the ability to vomit like a dog or a cat can, it makes it unnecessary to fast them. Hello, it's Carolina from Chile. Hello, Carolina, how are you? I would like to, she wrote in Spanish, I'm going to translate. Would like to know how to work the post-op protocol in animals, and tooth research. Well, that here's where I'm not sure exactly what all you're asking, what the tooth research deals with, but should consider the issue of, well, dextrose, for example, can give extra calories, and in some cases, and there are some papers written in which the hyperalimentation, feeding through, not through the mouth, it depends on the invasiveness of the tooth research, and it can be given through some gastric cannulas, but sorry, I don't know exactly what it is that you're doing, but maybe we can discuss that offline. You can always send me an email. Are there any of the non-pharmacological methods to minimize variables themselves? Well, we discussed a few today, and again, a good enriched environment. Bioserve, the company provides very good, can provide good input here, and yeah, there are other methods that needs to be implemented. Of course, I could not cover all of them. When individuals enter the animal room, the lights need to be attenuated. That will help post-op. Loud voices, cell phones should not be used in the animal rooms. You should be away from high noises. Perhaps you can place the rodent racks in the back of the room to minimize the stress so they can be more isolated. So there are all kinds of things you could do. Good morning. Is it worth to use S-ketamine? I'm not sure what S-ketamine instead of normal R-ketamine. I'm sorry, I don't know what S-ketamine or R-ketamine is. What are the benefits? I apologize, but I don't know. If you want to send the question again and specify what R-ketamine is versus S-ketamine, I will be glad to read it again. How many days post-op do you advise to increase the calories? Again, it depends on the surgical procedure, and if you're going to have a highly invasive procedure, then you might want to consider more days. So there's not an answer, a specific answer. But I'll tell you that I do at least the first day. Paul Flecknell believes, and I believe that too, that the first 6 hours in the recovery of animals, rodents in particular, is the most crucial time. So I encourage you to consider at least doing something in the first hours, the first day. Thank you for the presentation. Thank you again. Could you please repeat or provide that web page you just mentioned? I will. Let me tell you. I don't know if I could email. Here, let me look it up very quickly, and I will. It's Bioserve. Bioserve. Gosh, I apologize. I think it's BIOSERV hyphen. No, BIO hyphen SERV.com, I believe. I'm not sure exactly. Feel free to contact me offline. What I'll do is that I don't know how to bring my first slide with my email, and I could email it to you. Thank you so much. Learned a lot from your presentation. Well, I'm glad you did. Okay, to clarify, S-ketamine or R-ketamine, enantiomers. I'm sorry, I just really not familiar with that. Oh, there you go. Somebody sent me the Bioserve. Thank you, Stefan, for sending that. Is bio.serv.com. Again, bio-serv.com. Let me see if I have any more questions. Good morning, and again in Spanish, and I'll try to translate here. Do you consider to inject the glucose post-op? In many cases, it will help. So 5% dextrose, it could really help bring some necessary calories. It will be a clinical assessment. You see the animals are not eating well, and then they need a little extra calories. That could help. Yes, good idea. Oh, by the way, Bioserve is also one of the exhibitors at the conference. So thank you, Mary, for reminding me of that. You want to visit the Bioserve at the conference. Okay, I think those are all the questions. Thank you for your questions. Thank you for your attendance. It's been a pleasure. And feel free to contact me. And I think, I don't know how to bring my first slide. I'm going to try to bring it. If you want my email, if you want to send me more questions in the future, I'm trying to bring, I don't know how to get to the beginning, so I'm kind of sure I'm driving you crazy here. But here's my contact information. Again, feel free to contact me anytime. Okay? So this concludes this presentation. I'm going to leave the slide for a couple more minutes just in case anybody wants to write down that information. Thank you. It's been a pleasure. Oh, there seems to be another question okay, here that came up. Are the bacon softies or the IHL considered variables? Well, it could. However, I think that the variable of pain post-op could be more severe than the variable that you can introduce with the bacon softies or the gels. So you need to balance that. Thank you very much for the knowledge. Greetings from Chile. Well, Carolina, thank you very much. Well, I will say the next thing that Stepan said, but thank you for the compliment. And let me see, are there any other questions? Thank you so much. This was a wonderful presentation. Thank you. I'm embarrassed to read these things. But thank you so much. And it's been a pleasure. And I hope I can interact with some of you guys. Again, don't hesitate to contact me. And thank you, Stepan, for including me in this, the Veterinary Bioscience Institute, the BioConference Live. This is a great group of people. And I see other questions, but I think at this point I'm going to stop the presentation. I'm sorry I cannot answer anymore. I wish I could, but greetings to all. Bye.